There's a number of barriers that we feel are affecting access to innovative oncology care, and they include things like the design of healthcare benefits, particularly the high deductibles and high coinsurance, and the tiering of drug benefits, particularly pushing many of the new and innovative treatments into tier 4 and tier 5 high coinsurance tiers. So we think that those are significant barriers for many patients depending on the type of insurance coverage they have. Another big barrier is just the benefits management, if you will, within health plans. So we've seen a substantial increase in the burden being placed on providers in the form of step therapy or clinical care guidelines that are required, prior authorization requirements, preferred formularies. So that's another type of barrier that makes access to care difficult for some patients. Also, the way that a number of the benefit plans are now looking at reimbursement to providers, where more and more reimbursement is either value or quality based. So, and that's a mixed bag. That can be a good thing if it ensures that more appropriate care is being provided, but it can be a problem if providers are perhaps perversely disincentivized from providing care that they think is the best care. So the incentive payments around quality and value are sort of working their way through the system, and we'll see, to what degree they either promote or detract from the best quality care and access to innovative treatments. Another area that we're concerned about is just the overall inflation in the costs of therapy, and not just the medications, but therapy across the board, hospital care, professional services, the cost of treatment across the board, is becoming more and more a challenge for patients, particularly patients in the 200 to 400% of federal poverty level. Patients who are above the level where they get cost-sharing reductions in the Affordable Care Act, and above the level where they get subsidies under Medicare, so either low-income subsidies in Part D or qualified Medicare beneficiaries under the rest of Medicare. So for those patients, underinsurance is really a problem that can affect their access to innovative therapies. I guess lastly, the final problem we see is an inadequate safety net. So with all of the out-of-pocket costs that have built up over the past few years, we're seeing patients having a real difficult time finding ways to cover those costs. And the PAN Foundation obviously, provides a safety net for many patients. We help nearly 250,000 patients a year with their copays and deductibles, but we're just one organization, and the need is much greater than what we can meet. There, are a group of charities similar to PAN that my guess are probably providing assistance to over 1 million patients a year. But there are, just in Medicare alone, over 16 million people between 200 and 400% of federal poverty level. And almost by definition, if someone in that range becomes seriously ill or has a chronic illness, they're likely to be underinsured within Medicare Part D in particular. There's no out-of-pocket limit under Medicare. And patients today still would need to go through the deductible and coverage gap before they even got into the 5% catastrophic period. And even there, if they're on an expensive medication, and many of the oncology medications are costly, they would be paying $300, $400, $500 a month for treatment. So we think there are a number of barriers. There's different ways to address them, and that at least for the time being, organizations like PAN are a critical part of the safety net that's needed to address those barriers.